One thing that people are seeing on the news, and a lot of different information depending on what outlet they're listening to, is the death rate, or the likelihood of dying from COVID-19 if you get it. And it's been reported as anything as, 4 times what the seasonal flu is to something significantly less than a seasonal flu is. Can you speak to where these vast differences are coming from and where we can possibly find the truth?
There's a difference between case fatality rate and infection fatality rate. And before I go in there and give you the numbers, I'm going to explain what the difference between case fatality rate and infection fatality rate is. When we look at the fatality rate with coronavirus, we're only looking at people that are sick. We're looking at the tip of the iceberg, if you will, and we're looking what it is. We already talked about risk factors for these individuals. When we look at fatality rates, we're not getting information. The information is still hard to come by. There's not a lot of transparency here. So we're really not being able to look down at those instances and find out how many of those people were high risk. What you want to know is what's the infection fatality rate. And the infection fatality rate is going to be based on something called a point prevalence, which means how many people right now have SARS coronavirus 2, have COVID-19. How many people now have it, have had it, have recovered? What's that number? And then let's look at what the fatality rate is. I don't need to tell you that sitting down there and trying to get an estimate of how many people have had this is very, very difficult. There's been problems with antibody testing. There's been a problem with the types of antibody testing that I don't want to get into. But the tests that are available right now, I have a problem with. I have some real questions about how they're being done. I think they're inadequate. I don't think they answer the question. They're adequate. I mean, they're okay, but they're far from adequate to answering this question of what's the infection. So what you want to know is what's the infection fatality rate. We'll include some information from this. In one study, in one analysis by an author, put the infection fatality rate at about 0.25%, which is about what the seasonal influenza is. So if we look at that, it's about influenza. And there's a lot about this current coronavirus pandemic that matches up fairly well with influenza in a lot of ways, shapes, and forms. And this infection fatality rate, well, the reason why we know so much about influenza as opposed to coronavirus, it's been around. We've done lots of studies. We know what seroprevalence is. We know what point prevalence is in any one time. So we can come up with an infection fatality rate. But what we're dealing right now is with case fatality rates. And it really is like trying to tell us how many people drive intoxicated versus how many people who are intoxicated kill somebody in a car accident. Dramatically different numbers.
Okay, so then that would explain if a news outlet or whomever is speaking about case fatality rate, then it is naturally going to be significantly higher because they're talking about the people that have been diagnosed and who has died out of that population. So if a person were to hear that number, they might naturally be frightened because it sounds extremely high. But the reality is significantly more people have actually been infected. We can't exactly know that, but we do know that the way respiratory viruses work is that there are significantly more people infected than who have been diagnosed.
Right.
And so that's going to bring the rate lower.
CDC says it's 10%. And CDC, I mean, if you do the CDC number, there are 50 million infected Americans right now, between 33 and 50 million Americans. There's 100,000 cases in the state of Ohio. And in case my math skills are off a little bit, there's about 11 million people that live in the state of Ohio. Let me do some quick math for you. 10% of 11 million is 1.1 million, right? And 10% of 1.1 million is about 110,000. So that means in the state of Ohio, right now, 99% of the people in the state haven't had this.
And the deaths in Ohio for different age groups, the significantly highest age group or deaths in an age group is over the age of what?
65 to 75 for sure kind of thing. Okay. I think the next group is 50 to 75 and then under 50. and then we can look at under 18. We'll include those statistics. You can sit down there and look at them for yourself. I mean, the one thing that I can tell you just off the bat is looking at what the curves look like in the state of Ohio, and it's all available. All you have to do is Ohio Department of Health COVID dashboard. You can look at it for yourself. Yeah, I'm not going to tell you, but the graphs look like this. This is 0.0, and this is what the graph starts like. There's the first peak, and we have a second little peak, and the numbers are really going. It's hard, and you have to expand the scale to sit down and see it. The numbers are really going away. I mean, one of the things that people need to look at are excess deaths. I mean, that's what defines a pandemic, is how many people what are the excess deaths over in the past? And you can look at fertility rates in 2018, 2019, and you could look at the fertility rates right now. And if you look at now, the state of Ohio has really dropped back down again. And if you use that as a parameter, it's hard-pressed to say that we're still in the middle of a pandemic.
Can you explain just a little bit more the concept of excess deaths? What does that mean? Does that mean every year there's a predictable number of deaths in a state?
Based on the CDC in 2018, there's 7,708 people die in America every day. That's the number, 7,708. So if more than 7,708 people die per day for a persistent period of time, those are excess deaths. And once the rate drops back to 7,708, we're back to baseline again. No matter what else is going on, not that it's not there, but it's just not significantly impacting the overall health of the population enough that we have to marshal resources and efforts and medical science to sit down there and look at this. It's dropped back down to background activity, so to speak, kind of thing. That's what we mean by excess deaths. And that data is available for the country. It's a little harder to come for the state of Ohio, I'll be honest with you, but there's some data available in the United States. There's some data available for around the world in looking at these numbers too, and sit down there and see this, diminution in excess deaths below, which is kind of what describes a pandemic.
Okay, so as of August 15th, 2020, you're under the impression that the excess death rate is pretty much flat.
I mean, just look at the COVID dashboard in the state of Ohio, and you make up your own mind. Look at the graph kind of thing, and look where it goes. I mean, it's very, 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 very low. And look at it. Sit down there and look at it. I would encourage you to look at it, sit down, take it, draw your own conclusions. We'll include some available resources for you to take a look at it. You take a look at it, and you make up your own mind, but I know what it looks like to me.
This graph represents the dramatic increase in coronavirus testing in Ohio. This graph is available on Twitter and updated daily. You can find this graph by searching the Twitter handle at It's All Ohio. That's at ITSALLOHIO. The dotted white line represents Amy Acton's initial projected positive caseload with strict mitigation measures in place. The bright green line represents the actual number of cases in Ohio. The dark green bars represent the number of tests that take place each day in Ohio. This is a magnification of the last 2 months of the previous slide. This represents the number of cases and the number of tests performed. As you can see, the incidence of positive tests steadily hovers between 3 and 6% every day, regardless of how many people are tested. The total number of COVID-19 deaths in Ohio as of August 20th, 2020 is 3,929. Nursing home deaths represent 55.8% of the deaths at 2,195. For perspective, this data reflects influenza deaths in children under the age of 19. We examine one of the deadliest influenza seasons since the turn of the century, in 2009-2010, as well as the past 3 years. As you can see, H1N1 claimed 288 lives under the age of 19. From 2017 to 2018, 188 lives were lost to the flu under the age of 19. From 2018 to 2019, 144 lives were lost, and the 2019-2020 flu season claimed 187 lives under the age of 19. For comparison, in the past 6 months of 2020, 109 COVID deaths have been recorded in those under the age of 19. The economic impact of the government's COVID-19 response can surely be measured in multiple metrics. Here are just a few. In December of 2019, Ohio's unemployment rate was at an historic low of 3.8%. By April of 2020, it was at a staggering 17.4%. As of June, which is the latest data available, Ohio's unemployment rate was 11.1%. This data can be viewed at the Ohio Department of Job and Family Services website. As of April 2020, according to the National Bureau of Economic Research, at least 100,000 small businesses in the United States had already permanently closed. An August report by the Columbus Dispatch stated that 49% of all Ohio restaurants are expecting to close permanently. The devastating societal and cultural impact, which is often harder to quantify, still unfolds before us.